Good morning. It's my pleasure to welcome you to PYXERA's 5th Annual Conference on International Corporate Volunteerism. This year's theme is focused on catalyzing growth in emerging markets. I apologize to not join you in person to participate in these discussions among corporate, government, and social sector leaders about how private sector engagement in emerging markets is creating new business opportunities and opening new doors for citizen diplomacy, thereby enriching lives and livelihoods around the world. I'd like to take a few minutes to discuss two topics that are strategically important to BD. The first is applying the principle of shared value creation to enable business opportunities by addressing unmet societal needs. And the second is BD's Volunteer Service Trip program, a unique initiative that enables our employees to directly apply BD's company purpose of helping all people live healthy lives. First, let's focus on BD's commitment to shared value. Shared value is a relatively new term that has been championed by Professor Michael Porter of the Harvard Business School. Professor Porter and his colleagues identified BD as a company that had been applying shared value for several decades, in fact, much longer than the term itself existed. The concept of shared value is very simple. It's using business models to address unmet societal needs. Shared value lies at the intersection of social value creation and business value creation. Unlike philanthropy or corporate social responsibility, shared value is a commercial concept. It is applying the commercial capabilities of a business enterprise specifically to achieve positive social outcomes. By doing so, there's no limit to the scale of positive impact that can be achieved through shared value creation. Philanthropy and CSR are highly important and will remain so, but there's an inherent limitation to how broadly they can be applied. A company can only give away a portion of what it earns. But if a company can figure out how to address social needs through its commercial capabilities in a manner that also drives positive business outcomes, then there's no limit to the scale that can be achieved. Let me provide some examples of how BD has created shared value. One example that has been highlighted by Michael Porter is BD's efforts to protect healthcare workers from occupational injuries that can spread disease. This started 25 years ago with an unmet need: healthcare workers being injured on the job due to accidental needle stick injuries. BD was then, and remains today, the largest manufacturer of needles, and we felt we could do something about this. We began by designing and producing new medical devices with integral features to protect healthcare workers. But it soon became clear that this would not be sufficient on its own. So we further engaged in advocacy, awareness building, data gathering, and policy change efforts. These efforts were very comprehensive and ultimately entailed over $1 billion of investment. They involved an intensive level of collaboration with clinicians, researchers, clinical societies, and policymakers, starting in the U.S. and expanding worldwide. The outcomes which were achieved over the past 25 years reflect both aspects of shared value creation. Research data indicates that needle sticks and other sharps injuries to nurses declined by 51% between 1993 and 2001. And sales of safety-engineered devices became the single largest source of business growth for BD, today representing 25% of the company's total global revenues. These outcomes could not have been achieved solely through philanthropy or CSR. There are other examples I could share with you, but given available time, let's move to the second topic, BD's Volunteer Service Trip program. In 2005, BD launched its first volunteer service trip in Zambia to strengthen local healthcare capabilities in 5 cities and rural communities. Since then, 89 BD volunteers across 66 company locations from 15 different countries have participated in 8 volunteer trips to Zambia, Ghana, and more recently, Haiti. We are currently planning our volunteer service trips for 2014, where BD associates will be deployed to El Salvador, Peru, Papua New Guinea, and again to Haiti. The work of BD's volunteers ranges from clinical and laboratory training to construction of health clinics and laboratories to supporting applications in rural health facilities for funding grants. BD established an internal recruiting process that matches employee qualifications and skills to the needs of each volunteer assignment. Again, time doesn't permit me to go into much more detail, but I can say this program has been a huge success for the company and for our nonprofit partners, as well as a source of inspiration for our employees. Yesterday, you participated in a series of high-level discussions about how government and private sector leaders can collaborate in emerging markets to drive positive impact and transform business outcomes. There was particular focus on several key topics, including powering new business in new markets, livelihoods and leadership on the new frontier, development at the crossroads, the power of corporate diplomacy, and focusing on shared value as a means to forge a pathway of partnership. Now we shift our attention to international corporate volunteerism. In just a few moments, corporate practitioners and social sector leaders will address how volunteerism can enhance leadership and talent development, enable frontline insights that drive innovation, fuel hybrid and sustainable value chains, and support holistic community development. I'm pleased to introduce your first speaker of the day, Amanda MacArthur, PYXERA's Global Vice President of Global Pro Bono and Engagement. Amanda has been a pioneer in the practice of global pro bono and corporate volunteerism, working alongside corporations like BD, IBM, Merck, and SAP to help companies leverage our human capital and business acumen to build a better future for our world. Please join me in welcoming Amanda MacArthur to the stage.